Joining us live now is Dr. Isaac Bogosh, infectious diseases specialist at Toronto General Hospital. Dr. Bogosh, great to see you again. It's been a while. Let's get into it. There's a new COVID-19 subvariant called Arcturus, and it's on the rise in the United States. So two questions. Should we be concerned here, or are we at the point where new variants no longer pose serious threats given our vaccination rates, immunity, and generally where we are in this pandemic?
Right. Yeah, this is XBB 1.16. It's in well over 30 countries right now. Most of the data and news from this has come from India, where we know it's spread much earlier on. And as we know, these are sublineages of Omicron, so it's still under that Omicron umbrella. And it looks like more of the same in the sense that we've seen this happen several times before. It's still under the Omicron umbrella, but it's a slightly different version given the mutations, and it can evade some of our immunity to the virus from prior infection and cause an infection. Obviously, we don't want to get infected. We know that that can cause short-term or longer-term issues, and avoiding infection is the right move. But I think the key point here is remember the December and especially January 2022, when we had our first Omicron wave. It was terrible. It was a massive wave. Our healthcare system was overwhelmed. It was just a very challenging time. Since then, we've had multiple waves with an Omicron variant. We had a BA2 wave in the spring. We had a BA4 and BA5 wave in the summer. We had an XBB 1.5 wave in the winter, and none of those have come even close to putting the same pressure on our healthcare system as the first Omicron wave. And I think this is going to be more of the same. Yep, some people are going to become infected. That's tough. That's really sad. Yeah, sadly, some people are going to land in hospitals. Some people are going to succumb to this. That's really sad. We have to take steps to protect everybody. And booster vaccines for those eligible, and creating safer indoor spaces, that all helps. But it's not like we're going to see this sublineage of Omicron rip through and cause the havoc that we've seen, like we saw earlier in the pandemic.
Okay, that does sound definitely more promising than where we were with that first Omicron subvariant. And now let's talking about, safety indoors. I want to talk masking in hospitals. We recently reported that some hospitals around Toronto are kind of changing their masking rules about who should mask up, when and where. Do you think it should just be required everywhere in, health centers and hospitals to avoid the confusion for patients and staff or visitors?
Yeah, well, when you actually look, pardon me, sorry. Yeah, when you look at the hospital masking policies now, there's some differences in around Ontario, but most places are requiring masking in areas where patients are being seen. And I think that's important at this point in time, right? So if you're seeing a patient or you're on the nursing ward, you've got to wear a mask in those settings. There's other parts of the hospital, for example, non-clinical sites like, a cafeteria or other areas where masks aren't required. But most hospitals, not all, but most hospitals are still requiring masking in patient-facing areas, and I think that was a very reasonable decision taken by those hospitals that are choosing to do that.
Okay. Lastly, Dr. Bogosh, we got about less than a minute left. I want to talk avian flu. Yesterday, we said that Toronto ended its, I think it was like a chicken coup TO program for fear of the disease, avian influenza spreading. And you tweeted about a recent case in Chile where the human avian influenza was detected. So what was the update there?
Yeah, so we know avian influenza, if it infects a human or another mammal, it can be very, very severe. We obviously have to watch this extraordinarily closely. There was a human case in Chile, again, a very severe infection. The key point for this one is there's still very little and very inefficient mammal-to-mammal, including human-to-human transmission. Unfortunately, with this case in Chile, there were 12 close contacts, and none of them ended up getting avian influenza. Very good news. But again, something that we've got to keep our guard up. There's a lot of that circulating in migratory birds, which we know can infect scavenging animals. It can affect pets as well. We've seen that as well. So we still have to keep our guard up and watch this one closely.
Okay, Dr. Bogosh, that does it for our time this morning. Always a pleasure chatting with you. We'll speak again next week. Take care.
Have a great day.
You too.